Good morning, everybody. My name is Peter Siegler. I'm working at Ryerson University as a postdoc together with Dr. Victor Yang. And we defined actually a problem during brain biopsies, which we address, which is here you can see a normal patient, has it presented here, the MRI image. And as you can see, there is a suspect region in that area, which we don't know what it is. So in order to find out what it is, we want to make a brain biopsy, which is actually just putting a needle into the region of interest, taking out some issues and send it to pathology to define the sort of tumor it is to make the decision how to proceed with this medical case. However, when the patient goes into the operating room and the surgeon is opening up the skull, putting the needle in, even if we have the perfect position of the needle and even if we put it in the right angle, the brain tissue itself can actually deflect the needle. So you might end up with a situation like shown over here, that the needle, even if we think we're on the right spot, is actually not inside the region of interest. This might cause some problems. The pathology might say, okay, we didn't hit it, make a second shot, make a second input of the needle, or even worse, we end up with a bad diagnostic of that patient. Looking at our competitors in this case is two major players, which is Medtronic and GE, both having a revenue of about 150 million in 2007. Both of them use a technique where they place in the operating room an antenna next to the head, and they have another antenna in the needle, so they can then track the position of the needle tip. Disadvantages of this technique is actually you only get the information about the needle tip, versus our technique gives you the whole trajectory. Then there is a small workflow efficiency issues, since you have to mount first the antenna next to the head on the bed. There's a kind of a poor accuracy. Just by talking to our surgeons, they brought up that question. Also, there is another thing that it's an RF-based technique, a radio frequency-based technique, so every metallic in the field is actually causing distortion, so each medical instrument would cause some problems over here. So looking at our technique would address all these problems, and the interesting would be actually four parties which we identified. It's either the surgeon, which actually has now more confidence when he does the biopsy. There is also a small side notice that actually there is already a reimbursement model. The surgeon can actually bill for a navigated procedure. Then there is the hospital, which is actually interested because it actually increases the care of the patient, as well as it helps them to reduce the cost if the operating room time goes down, if it is not necessary to do a second shot of the needle biopsy. For the patient, obviously, it's interesting because it increases the care of him, as well as it's reducing any risks, because each insert of a needle we might hit a blood vessel on the path, so doing less of these is actually reducing its risk. Also from the company perspective, there is an interest for actually these Stryker and BrainLab. I put them over here because they have navigation systems, but no technique to actually detect the needle bending itself. So for them, it might be interesting just to increase their portfolio. And for companies like Synaptive or 7D, which are actually new in the field, it's interesting actually for the same reason, just to kick off their business. So coming to the milestones and the timeline I have for this project, where is first of all, we want to do some more work on the technique itself. We have to work a little bit on a calibration phantom and the combination of the two techniques, bringing it into the surgical navigation system. When we are already in the way of filing a patent to save our IP issues, we are actually thinking that we can actually put more of these, but the major one is actually on the run. We are actually on the fortunate situation that we have a pig study already going on at Sunnybrook, and it might be possible to add our technique to do this in the field think. I have a lot of experience of doing human studies already in a company before and in my research work. So I hope that we can kick off a clinical study very soon. And obviously also do, in the meantime, the development of a goal marking strategy and thinking of getting contacts to new customers. So I thank you for your attention.